Several patients in this country have already begun to experience a condition known as long COVID, where symptoms such as shortness of breath and fatigue continue for a length of time after recovery. Chief Medical Officer Dr. Roshan Parasram says this new term was coined internationally as COVID-19 patients have been taking almost 3 to 4 months to fully recover. Sunil Lalla has more.
It's almost a brand new term being used internationally, where the condition known as long COVID is having a debilitating effect on people's lives, leaving many exhausted even after a short walk. Dr. Parasram says COVID-19 is still a brand new virus and he expects to see more symptoms attached to the long COVID condition. He says the main conditions seem to be persistent shortness of breath and fatigue, and adds that people are taking months to recover.
What we are seeing is that persons can, what we would have thought, just like any other virus, once you recover in 1 to 2 weeks, you're back to full function. What we are seeing is individuals taking as much as 3 to 4 months to actually recover, if they recover their full function at all.
But Dr. Parasram says long COVID seems to have an effect mostly on those with comorbidities.
So the two main things that we have seen in Trinidad, at least, and documented in the evidence are persistent shortness of breath, and persistent fatigue, which have gone on for a considerable length of time after recovery. And those are traditionally in persons that would have had comorbidities or persons that would have been in a high level of care, for instance, HDU or ICU settings.
He adds that people who would have had pre-existing conditions such as heart attack or stroke, recovery may also be lengthened.
Those that would have had thromboembolic events as a result of COVID, or because they had pre-existing conditions which were worsened from COVID. For example, you would have had a heart attack or a stroke. Of course, the rehabilitation pathways will be along the lines of those particular illnesses as well.
Due to this, Dr. Parasram adds that a special unit is being set up to treat with any respiratory issues.
We are establishing a unit within the North Central Regional Health Authority through the RHAs, where persons can undergo respiratory physiotherapy who have recovered from COVID. And there's a particular unit under Dr. Trotman that will be established hopefully soon.
According to several studies, mental health problems have been reported as a symptom of long COVID, including depression and anxiety. Sunil Lalla, TTT News.